Taking amlodipine? That grapefruit juice in your morning routine could be silently working against your medication, making it up to 3 times more potent than intended. Your blood pressure medication's effectiveness depends not just on taking it regularly, but also on what you pair it with. Today, we'll examine 12 specific items, from common foods to medications, that could interfere with your amlodipine. I'm breaking down the science-backed evidence about these interactions so you can make informed decisions about your health. After reviewing hundreds of clinical studies and consulting with healthcare professionals, we've identified the most critical combinations to watch out for when taking this medication. This information could help you avoid unwanted side effects and ensure your blood pressure medication works as intended. However, if you must take an additional medication while on amlodipine, consult your doctor or pharmacist for safe alternatives that might effectively manage your condition. They could suggest different medicines or adjust the dosage to lower the risk of potential adverse effects. Always make changes to your medication under proper medical advice. Do remember that all medications can cause side effects, and it's crucial to identify what works best for you and what should be avoided while taking them. Before we dive in, let's explore what amlodipine is. Amlodipine is a key member of the calcium channel blocker group, which offers a unique method of controlling high blood pressure. These drugs function by preventing calcium ions from entering the heart's and blood vessels' smooth muscle cells. Calcium is crucial for muscle cell contraction, including those in the vascular system. When calcium enters these cells, it initiates a contraction that narrows blood vessels and raises pressure. By obstructing the channels through which calcium enters, amlodipine halts these contractions, resulting in the relaxation of blood vessels. This widening of the vessels lowers blood pressure and improves oxygen and blood supply to the heart. It is vital to understand that amlodipine's metabolism can be affected by other drugs and substances, which we will explore in this video. A quick note, this video is for educational purposes only, so be sure to speak to your doctor if you have any medical concerns. Now, let's examine what needs to be avoided when on amlodipine. Now we will rank our list from 12 to 1. The item in second place, something we consume daily, will surprise you. Where are you watching us from? Let us know in the comments. Before we continue, please make sure to subscribe to the channel and leave a comment. Even typing 1 if you liked the video means a lot to us. We'd love to hear your thoughts about our videos and our channel. Which of these habits inspired you the most? Leave a comment, and let's grow stronger together. Number 12. Alcohol while taking amlodipine. When using amlodipine, which is a medication commonly prescribed for high blood pressure and angina, it's important to keep a close eye on your alcohol consumption. Amlodipine works by relaxing the blood vessels, allowing the blood to flow more easily and reducing the heart's workload. However, alcohol can increase the side effects of amlodipine, such as feeling dizzy or lightheaded. These symptoms can be particularly dangerous, as they might hinder your ability to carry out daily activities safely, like driving, cycling, or handling heavy machinery. Furthermore, alcohol can exacerbate the potential side effects of amlodipine by deepening the level of blood vessel dilation and relaxation, which can contribute to an unsteady or hazardous physical condition. According to a study published in the Journal of the American College of Cardiology, excessive alcohol consumption is directly linked to significant fluctuations in blood pressure, which could be dangerous for individuals taking medications like amlodipine. Taylor et al., 2014. These fluctuations arise because both substances interact with the cardiovascular system, making their combined impact difficult to predict. Additionally, drinking alcohol while on amlodipine may heighten the risk of experiencing a sudden drop in blood pressure when standing, a condition known as orthostatic hypotension. This sudden decrease could lead to fainting or falls, potentially resulting in injuries such as bruises, fractures, or head trauma. Moreover, alcohol itself can influence blood pressure, a factor that might intensify when combined with amlodipine. For individuals already at risk of hypertensive complications, this combination poses an uncertain danger, leading to the suggestion that those on amlodipine treatment should monitor or markedly limit alcohol consumption. For these reasons, it's prudent to either refrain from alcohol entirely or consume it moderately, under medical advice, while taking amlodipine to maintain optimal health and safety. Number 11. Grapefruit juice, though generally considered harmless, can present an unexpected issue for those taking amlodipine grapefruit. Grapefruit juice blocks an important liver enzyme called CYP3A4. Why does this matter? Because this enzyme helps your body break down amlodipine. Without it, the drug builds up in your system, which can lead to stronger side effects like swelling, dizziness, and flushing. This interaction has been proven in clinical studies, including one published in Clinical Pharmacology and Therapeutics. This common morning drink interferes with how amlodipine is processed in the body. The components in grapefruit juice block an enzyme essential for breaking down amlodipine. Consequently, this interference can cause higher levels of the medication to remain in the bloodstream, which increases the chances of side effects like dizziness and noticeable skin flushing. It is recommended to be cautious about this interaction. The simplest advice is to completely avoid grapefruit juice while undergoing amlodipine treatment. However, since people's eating patterns and preferences differ, discussing with a pharmacist can provide tailored advice. This dialogue can assess potential risks and determine the best timing for consuming grapefruit juice concerning amlodipine doses, aiming to reduce any negative effects. Number 10. Simvastatin plus amlodipine, a risky mix. When simvastatin, a commonly used statin, is taken alongside amlodipine, there's a significant increase in simvastatin blood levels. Amlodipine inhibits the CYP3A4 enzyme, which normally helps metabolize simvastatin, leading to elevated plasma concentrations of simvastatin muscle pain, weakness, and myopathy. Higher simvastatin levels mean a higher risk of muscle-related symptoms. Rhabdomyolysis, this serious condition, marked by severe muscle breakdown and potential kidney damage, has occurred in patients taking both medications. Clinical evidence. In real-world data, cases of elevated creatine kinase, an indicator of muscle damage, were about 3 times more common when simvastatin 40 mg was co-administered with amlodipine versus simvastatin alone. Alternatively, consider switching to a different statin, such as rosuvastatin, pravastatin, or atorvastatin, which don't interact as strongly with amlodipine. What you can do. 1. If you're on both medications, talk to your doctor or pharmacist. 2. Ask whether your simvastatin dose should be lowered to less than or equal to 20 mg. 3. Explore switching to a safer alternative statin. 4th, monitor for unexplained muscle pain or dark urine, which could signal rhabdomyolysis. 4. Ginseng, renowned for its energizing properties and its ability to enhance the immune system, poses a significant danger when used alongside amlodipine. This herb, often praised for its health-promoting attributes, can directly counteract the intended outcomes of amlodipine treatment. Ginseng's effect on the cardiovascular system may cause an increase in blood pressure, which directly contradicts the blood pressure-reducing goals of amlodipine. Such an increase not only diminishes the medication's therapeutic benefits, but also escalates the potential risk of worsening cardiovascular conditions. Additionally, ginseng has been found to alter the body's metabolism of certain drugs, which could impact amlodipine's overall effectiveness. This interaction may lead to insufficient management of hypertension or angina, increasing the risk of heart-related issues. Given the complex interplay between ginseng and amlodipine, individuals on amlodipine therapy are strongly advised to proceed with caution before adding ginseng or similar supplements to their routine. Consulting with a healthcare provider or pharmacist is essential. Number 8. Antifungal medications. Navigating the management of medications like amlodipine requires careful consideration of potential interactions with antifungal drugs. Medications such as ketoconazole or itraconazole, which are typically used to treat fungal infections, can create complications when taken with amlodipine. The interaction between amlodipine and certain antifungal drugs demands attention due to its potentially serious health implications and its effect on the effectiveness of treatment plans. Antifungal medications, especially those classified as azole antifungals, can inadvertently lead to elevated levels of amlodipine in the bloodstream. This elevation happens because the same liver enzymes metabolize both amlodipine and certain antifungal medications. When these antifungal drugs inhibit enzyme activity, they slow down the breakdown of amlodipine, causing its concentration in the blood to increase. Consequently, patients might experience amplified effects of amlodipine, including a significant drop in blood pressure, a heightened risk of edema, and potentially life-threatening cardiac issues. The ramifications of this interaction are both pharmacological and clinical, as patients might show symptoms that resemble excessive amlodipine exposure, such as dizziness, limb swelling, or severe fatigue. These signs underscore the necessity for urgent medical assessment and possibly a change in the medication plan. Number 7. Diltiazem and verapamil. When taking amlodipine, it is crucial to manage the use of other medicines, especially those belonging to the same drug class. A couple of these medications, diltiazem, DILM, and verapamil, are also calcium channel blockers, like amlodipine. They are typically prescribed to treat similar conditions, such as high blood pressure and heart diseases. These drugs work by relaxing blood vessels, which enhances blood flow and reduces the heart's workload. However, using amlodipine together with either diltiazem or verapamil can amplify their effects, potentially causing a significant drop in blood pressure and heart rate. This could lead to symptoms like dizziness and fatigue, and in more serious cases, result in conditions like hypotension or bradycardia. Such issues pose substantial health risks and demand prompt medical attention. The reason behind this interaction involves the cumulative effect of multiple calcium channel blockers, as each drug restrains the action of calcium in blood vessels and the heart. Therefore, taking them simultaneously may lead to an intensified response, causing the symptoms mentioned earlier. Furthermore, diltiazem and verapamil may alter how amlodipine is broken down in the body, resulting in higher levels of amlodipine in the blood and augmenting its impact. Number 6. St. John's Wort. St. John's Wort, a widely utilized herbal supplement for alleviating depression and anxiety, can notably interact with the medication amlodipine, a crucial point for patients to note. This natural product stimulates the activity of liver enzymes, which are essential for metabolizing various medications, including amlodipine. By enhancing the breakdown of amlodipine, St. John's Wort can significantly reduce the drug's concentration in the bloodstream, thereby compromising its effectiveness in managing blood pressure or angina. Such reduced efficacy could leave individuals susceptible to the very conditions that amlodipine is prescribed to address. The risk associated with this interaction extends beyond just diminished drug levels. It also involves potential rebound hypertension or the resurgence of angina symptoms due to insufficient medication performance. Patients on amlodipine are strongly advised to avoid using St. John's Wort. If they are considering its use, it is imperative that they first seek advice from their healthcare provider or pharmacist. This caution is supported by a study conducted by Izzo et al. 2009, which highlights several cases of significant drug interactions involving St. John's wort and various pharmaceuticals. Their research underscores the importance of being aware of potential interactions, especially when dealing with medications like amlodipine, to prevent adverse effects and maintain therapeutic efficacy. As a result, patients on amlodipine must remain vigilant and consult healthcare professionals before incorporating St. John's wort into their regimen to ensure their safety and treatment success. Number 5. Licorice. Licorice, a well-known ingredient for its sweet taste, is commonly found in various foods and supplements. People taking amlodipine, a medication often used to manage heart-related conditions and high blood pressure, should be aware of the possible effects licorice can have on their medication and overall health. This concern is primarily attributable to glycyrrhizin, a compound present in licorice. Glycyrrhizin has been shown to alter levels of potassium in the body, which can be significant since potassium is crucial for heart function and maintaining electrolyte balance. When potassium levels drop, individuals face a higher risk of heart complications, posing a serious concern for those on amlodipine. The medication is typically prescribed to treat conditions like hypertension and angina, so consistent potassium levels are vital for its effectiveness. If potassium decreases, the efficacy of amlodipine in managing blood pressure and chest pain may be compromised, making it more challenging to maintain cardiovascular health. The interaction between licorice and amlodipine does not stop with the issue of potassium. It also extends to the balance of electrolytes in the body, which can have a cascading effect on heart health and function. A study published in the Journal of the American Heart Association in 2017 presented findings that excessive consumption of licorice, particularly in large amounts, can lead to significant drops in potassium levels, resulting in arrhythmias and elevated blood pressure. Goldberg et al. 2017. These findings underscore the potential dangers for individuals using heart medications. Considering these risks, it's advisable for patients on amlodipine to limit or completely avoid consuming licorice in all its forms. This includes not just direct forms, such as candies and extracts, but also its use as a flavoring in foods, beverages, and herbal remedies. Being mindful of licorice intake is essential to ensure the consistent effectiveness of amlodipine and to protect cardiovascular health. Number 4. Goldenseal, a herb valued for its strong antimicrobial properties, is often used for its potential to boost the immune system and fight various infections. However, despite these benefits, Goldenseal presents certain issues for those taking amlodipine. One major reason for concern is Goldenseal's influence on drug metabolism, including amlodipine. It has been found that Goldenseal can inhibit the activity of specific liver enzymes responsible for breaking down medications. This inhibition may result in increased levels of amlodipine in the blood, raising the risk of side effects from the medication. Additionally, the interaction between Goldenseal and amlodipine could cause unexpected changes in blood pressure, which makes it difficult to maintain the stability crucial for those with hypertension or angina. The chance of heightened side effects, such as excessive lowering of blood pressure, dizziness, or other symptoms, is amplified when Goldenseal and amlodipine are used together. Due to these potential risks, it is advised for individuals on amlodipine treatment to avoid Goldenseal to prevent interference with their treatment plan. Number 3. High-fat meals. Eating a diet high in fat can significantly influence how amlodipine functions within your body. When you consume meals laden with fats, the absorption rate of amlodipine into your bloodstream may slow down. This means that the medication could take longer to reach its full effectiveness, which might impact its efficiency in managing blood pressure. The interaction between fatty foods and amlodipine doesn't end merely with absorption. It can also interfere with the overall health objectives that amlodipine aims to achieve. Therefore, individuals on amlodipine therapy should be cautious with their dietary fat consumption, and opting for lower-fat meals ensures a more steady absorption of the medication. By maintaining a consistent medication uptake, a steadier action against hypertension is achieved. Incorporating a diet rich in vegetables, fruits, lean proteins, and whole grains is essential, as it complements and enhances the action of amlodipine, thereby contributing to a healthier cardiovascular system. A study published in Clinical Pharmacokinetics highlighted that the presence of high-fat content in the diet can affect the pharmacokinetics of medications like amlodipine. The study emphasizes the importance of dietary considerations in ensuring optimal efficacy of hypertension medications. Number 2, caffeine. Caffeine, a commonly found stimulant in coffee, tea, chocolate, as well as many soft and energy drinks, can have a substantial effect on your blood pressure. For individuals on amlodipine, controlling caffeine intake is critical to maintaining the drug's effectiveness in managing hypertension. The issue with caffeine is its ability to temporarily boost blood pressure by causing the heart to contract more forcefully and narrowing the blood vessels. This reaction could work against amlodipine's role, which is intended to relax blood vessels, thereby improving blood flow and reducing blood pressure. Although occasional moderate intake of caffeine might be permissible for some individuals, consistently high doses can lead to unpredictable control of blood pressure and may exacerbate side effects of amlodipine, such as headaches or heart palpitations. Consequently, it is advised for those on amlodipine to limit their caffeine consumption to lower levels, generally suggested to be under 200 milligrams per day, roughly equivalent to 1 12-ounce cup of coffee. For those struggling to cut down on caffeine, transitioning to beverages with lower caffeine content or choosing decaffeinated options can be helpful. Research published in the American Journal of Clinical Nutrition confirms that high caffeine intake can lead to increased blood pressure, which is critical for individuals managing hypertension, particularly those on blood pressure medication like amlodipine. Number 1. NSAIDs. Combining amlodipine with non-steroidal anti-inflammatory drugs. NSAIDs, such as ibuprofen and naproxen, might be more hazardous than it seems. Although these drugs are effective in treating various conditions like joint pain, they can counteract the positive effects of amlodipine on blood pressure and potentially impair kidney function. This negative interaction occurs because NSAIDs can decrease the effectiveness of blood pressure medications by promoting sodium and water retention and causing blood vessel constriction. This can negate the blood pressure-lowering effects of amlodipine, inadvertently increasing blood pressure levels. This combination is particularly concerning for individuals with pre-existing kidney issues, as amlodipine and other antihypertensive medications can modify kidney function by targeting systemic blood pressure. Combining them with NSAIDs, which can further impair kidney function by reducing blood flow to the kidneys, can escalate the risk of kidney damage. Due to these prominent risks, it's crucial to proceed with caution when using amlodipine alongside NSAIDs, and such combinations should only be taken after explicit consent from a pharmacist who can thoroughly assess the potential risks and benefits in the context of your overall health. For those who require an anti-inflammatory or pain relief medication while taking amlodipine, alternatives that have a milder impact on blood pressure and kidney function may be advised. A report from the Nephrology Dialysis Transplantation Journal highlights the potential renal harm resulting from concurrent use of NSAIDs and blood pressure medications, underlining the necessity for caution in prescribed settings. 3. If you enjoyed this video, don't forget to like, subscribe, and turn on notifications so you never miss our next health guide. Thank you for watching and supporting our channel. We've picked 2 more videos just for you. Click one now, and let's keep learning together.
Which of these habits inspired you the most? Leave a comment and let's grow stronger together.